Well, thank you very much, and Chair Baldwin, Ranking Member Capito. It is really great to be back at this subcommittee, which is in great hands with two women. I'm very glad to have colleagues as well, and I'm looking forward to working alongside the chair and the ranking member, all members of this subcommittee as we return to regular order and work to find common ground to build a stronger economy and make our communities safer. And today's hearing really offers a really important reminder that when it comes to making our country safe and strong, investing in our families and workers is really key to our economic success. Defense spending is absolutely important, but it is only part of the equation because our families across this country, being safe includes knowing they can get health care that they need. It means addressing the devastating maternal mortality crisis and the opioid epidemic. It means training and retaining a strong healthcare workforce. It means building a robust public health system so we can prevent and respond to threats like dangerous disease outbreaks, and making sure that women in every corner of this country can get the healthcare and family planning services that they need. And while these health challenges make people less safe, there is also the child care crisis. And Mr. Secretary, you know, Madam Chairman, you know, this is really important. This is straining our parents' budgets. It's forcing them out of the workforce. We have to solve this crisis, which is why I will continue to raise this as a top priority of mine. And I'm going to be reintroducing my Child Care for Working Families Act fairly shortly. I also want to note, Secretary Becerra, we need to live up to our obligation to care for the migrant children in our nation's custody. I'm going to be working hard with all of my colleagues to make sure we draft a funding bill that provides the investments that keep our families safe and healthy and our economy strong. So welcome to this committee. I do have some questions. The Child Care Stabilization Program was created by Democrats in the American Rescue Plan. It has been an incredibly successful program. In my state, over 6,800 providers received funding, and that has helped us with over 184,000 children in my state alone. And stabilization funds kept those providers' doors open. They supported wages and benefits for workers and critical operational costs. But as we know, this funding is set to end, and the child care crisis is still with us. Secretary Becerra, the President has proposed a significant investment in both mandatory and discretionary funding for child care. Can you tell us about the current state of the child care sector and why this significant investment is needed?
I have to begin, Senator, by first saying thank you for helping us ensure that we could come to you with a decent budget. And so thank you for the work that you've done over the years on this subject. Second thing I'll say is this probably explains it all when it comes to childcare. You can still make more money flipping burgers than you can caring for our next generation of leaders. I just don't understand it, how it is that we expect someone who is taking care of the people we love most, our children, less than we pay someone to go to McDonald's and flip burgers. That essentially points out why childcare is in such a difficult state. We don't pay enough, yet it's still too expensive for most families to afford it. Only 1 in 7 families is able to send a child to childcare. And so you can understand why the President is committed to this. These are hundreds of billions of dollars that the President is trying to commit because that's what it will take. He's also making a commitment to pre-K and to Head Start. He would like to see every child who's 4 years of age have access to pre-K. And so my mom used to say it best, mejor prevenir que remediar. Better to prevent than to remediate. We know if we start early with our kids, they're going to have a chance to grow up strong. Frederick Douglass said it better. Easier to build strong children than to repair broken men. We're letting a lot of kids become broken, and then we try to repair them. Let's build them strong at the beginning. Investing in childcare does it.
Well, thank you for that. And let me ask you about a report that the CDC released. It's really shocking, on the alarming maternal mortality crisis in our nation, which found that the maternal mortality rate has risen 40% since 2020. Can you tell me how the department's existing work is going and what the additional investments in maternal health in this budget will do?
We've really zeroed in here. You're aware that today we have challenged every state to offer to a woman and her new baby postpartum care, not just for 60 days under Medicaid, but for 365 days. So we just got the 30th state, Oklahoma, just came on board, but that means there's still 20 states in America that are not offering this care. That's hundreds of thousands of women who are about to deliver who will only have postpartum care for 60 days. And we know that in many cases, the woman, the mother, or the baby will have an outcome, including death, that will leave America hurting. And so we believe expanding access to Medicaid, we are concentrating monies directly on maternal health care. We know the crisis is biggest in the African and indigenous communities of our country, and so we're going directly where we know these women are.
Thank you. Thank you very much. Thank you, Madam